Thank you for joining. This is Nancy Harvey with Opargo. If you're receiving this video link, it's likely that you recently attended a webinar that we co-hosted with Allscripts and some of their other partners. This webinar was intended to provide you solutions to help manage the current COVID-19 situation that we've all been faced with. To help you understand how Opargo can help manage this current healthcare crisis, I think it's helpful for you to understand a little bit about our background. So, Opargo was actually founded based upon the same technology that the airline industry has used for years to maximize air travel. We're using those same predictive analytics to route patients appropriately, understand when patients are going to present with certain demand, and make sure that you're providing the level of care based upon the current needs of your patient population. Because of Allscripts and Opargo's strategic partnership, everything that's scheduled through Opargo ends up looking like it was scheduled in Allscripts to begin with. None of your patient engagement, billing workflows, or clinical workflows will be negatively impacted. So many offices are transitioning to virtual health visits. We want to provide solutions that help better plan for automating that process. With the impact of COVID-19, so many practices are needing to manage their patients' care in a different way. So many of those are being routed to telehealth visits. Opargo helps automate that process by making sure that the appropriate visits are routed to telehealth and or to your testing centers or whatever the method is that is appropriate for the care that you need to deliver to those patients. Practices are still needing to manage the patients that they would typically take care of even prior to this current crisis. Patients that have critical medical needs but might not be COVID-19 related. We make sure that those patients are not lost in the mix and that we have rules to prioritize the care based upon the ones that can be cared for a little later down the road or ones that need to be cared for now. Practices also need insight for what adjustments are going to need to be made on a move forward basis. Opargo will provide automated reporting with algorithm updates based upon how this market changes. We don't know what care our patients are going to need 1 week from now, 2 weeks from now, a month from now. What we can do is use data to help model that. And when things do come back to normal, we have the ability to make sure that you're prioritizing then the onslaught of visits that will need to be seen at that time. In order to deliver the patient care that's needed, we'll need to make sure that visits are routed appropriately based upon where and how that patient should receive care. In your testing centers or maybe your office, you're going to treat patients that have flu-like symptoms that may or may not have underlying medical conditions. You're also going to be treating those patients with urgent needs that we talked about earlier that might not be COVID-19 related, but nonetheless need your help. Your telehealth environment will treat patients that have urgent issues but can be treated virtually. We can also treat patients with non-urgent issues to continue to take care of those patients and keep the viability of your practice moving forward. We do also want to capture visits that can wait. So maybe some of those back to school exams. We're not saying that we're never going to schedule those again. We're just saying not yet. Let's push them out a little bit, but let's go ahead and get them scheduled on the books so that when things do begin to return back to normal, you have those patients captured. And if you have current patients that are scheduled for visits, we may choose to reschedule those for future dates as well. Digging in a little further, we're going to show how Opargo can automate care based upon guidelines for COVID-19 and beyond. So first we're taking a look at a patient who has flu-like symptoms and also has underlying medical conditions. That obviously is very urgent. This could be a new or existing patient. The provider could be a designated provider that is essentially managing those types of patients for today, or it could be their existing provider that they normally see. We're of course going to make sure that everything gets billed out appropriately through your Allscripts billing systems, and that the patient's being cared for at the appropriate location, whether that's a testing center, in your office, or via telehealth. Those, of course, represent the highest of priorities. Then we've got another patient that presents that has flu-like symptoms but has no underlying medical condition. Still urgent. We can still see new or existing patients. Same applies for providers. We might have certain providers that are seeing those types of patients for that day, or they would see their existing provider. But the designation for the location might change. So we might choose to only see those patients via telehealth, and they might not receive as high a priority as a patient that has underlying medical conditions. So the priority is designated as moderate. Your non-flu like patients can still be urgent. You have patients that might be experiencing some problems related to strep throat or hypertension, things that still need to be seen. Of course, also new and existing can be seen by the appropriate providers in your organization, and then also handled potentially via telehealth or in the clinic. Those are going to receive a moderate to high designation. Your non-urgent, non-flu-like visits could potentially be treated via telemedicine or a few weeks out. It really depends on the scenario, depends on the types of patients that your practice is treating and what your goals are and your care delivery plans. Opargo can be totally flexible and customizable to be able to route patients appropriately. Like we talked about before, Opargo is going to work with your Allscripts templates to make sure that these visits are routed appropriately. So in this example, an established patient with flu symptoms that has underlying medical conditions might be only routed to your Allscripts clinic template, where an established patient with a medically urgent issue might go to telehealth there on the left or to your normal clinic. Where your new patient annual physical, we've pushed that out maybe a few months into the future. Again, we're still capturing that visit, we're just not scheduling it now. Let's hop into Opargo and take a look at what it looks like to actually schedule a visit. I'm now in the Opargo application with a patient looked up. This patient is complaining of flu-like symptoms and has underlying health conditions. Let's select Find First Available. You'll notice a couple of things about how the providers and locations have returned on this page. Remember, for a new patient with underlying health concerns that's expressing some flu-like symptoms, we can see them at our main location, which is our clinic, or you may choose to route them to a testing center. So this Allscripts South could be your testing center, as well as Allscripts North might be your telehealth. I also have multiple providers. Dr. Ennis is also seeing patients at the main location, but he's not doing telehealth or seeing any visits at the testing center, so that location isn't returning for Dr. Ennis. For this particular patient, we're going to go ahead and schedule them at our testing center. All we have to do is find a time that works for the patient and select schedule. In real time, that appointment then is scheduled in Allscripts, looking just like it was scheduled there to begin with, but your staff didn't have to figure out how to manage that patient based upon the rules of your practice. Opargo led them right down the road of where they needed to go. Let's schedule another visit. Another patient calls. This particular patient just needs an annual physical. So we'll choose an established patient annual physical. We'll also select Find First Available to find the appointment that works best for this patient and the goals of the practice. You can see that Find First Available in this situation didn't return any immediate appointments. This patient is wanting an annual physical, and we have configured Opargo to return appointments into the end of April. Okay, patient, looks like we're not going to be able to see you till the end of April. Let's go ahead and get that scheduled. And certainly if things change and we can get you in sooner, we'll let you know. Great, that patient's scheduled and will be coming in for their annual physical as soon as the dust clears. We know that things are stressful right now, so we have created an abbreviated rollout process to get you guys up and running so that you can appropriately care for patients as soon as reasonable. Because let's face it, your scheduler's world has been turned upside down in addition to everyone else there at your locations. All the scheduling rules have changed. Let's give them the tools that they need to appropriately care for your patients. In an effort to make this process as easy as possible, we've removed financial barriers by reducing our implementation costs by 50% and making no monthly subscription fees due for the first 120 days. When they do become payable, they're $99 per provider per month for the term of the contract. To implement, we need VPN connectivity to your Allscripts database. Opargo will 100% walk you through the appropriate setup for your location based upon your input. We'll make sure that your templates are set up in the way that we need them to for patients to be delivered appropriate telehealth care as well as regular clinic care. We'll make recommendations based upon specificity of appointment types by your specialty and other nuances of your practice. But then we'll also return you some very interesting data that we use for your implementation for future analysis and future practice improvement. On an ongoing basis, we'll provide reporting tools that show provider utilization, an understanding of how these visits are panning out, what your demand looks like for each one of these types of disciplines, how well your different locations are being utilized, and where those patients are coming from. On a move forward basis, we will also continue to analyze your system and provide 2 optimization algorithm updates as a part of this initial offering. This will help us manage changes in your demand and utilization, and then also make any adjustments based upon changes in your strategies and goals. We certainly have to be very dynamic and be very nimble as it relates to the crisis that we are currently in and how you need to manage your patients appropriately. Thanks so much for your time today. If you'd like to learn how to augment those telehealth and virtual visits by implementing Opargo, drop me an email at nancy@opargo.com. You can certainly reach out to any of your Allscripts representatives as well, and they will make sure that you receive the appropriate direction and information needed. Thanks so much. Look forward to speaking with you.